for only for a short time, and now the funding has dried up with the financial crisis in Spain. I've been asking how, haven't I? How do you do it? How do you do it? How do you do it? Here's one answer. Community health workers, and they're called many different ways. Let's talk a little bit more about them. I mentioned I studied in Mexico. The last year, the social service year, for some reason when the school was created, one of its leaders went to the government and said, when you have the social service year, send our graduates to the most faraway places because they're learning to be missionaries. Believe me, we were not thankful. But it's true. And in my year, they started a campaign called Bandera Blanca, which is white flag. They wanted to get communities to the stage where every health problem was either seen or under control, at least the health system knew about it. So in a community, every pregnant lady should be under care. Every child under 5 years old should be seen by a physician, have their immunizations up to date. Every diabetic should be under control, every hypertensive, and so on and so on and so on. How do you do that? How do you get everybody in your community to a place where you know as a health system what's happening to them? How do you do it? And let me add to that, no money, no extra money to do that. Well, I chose a community that was isolated from the rest of the city, so it was objective. Off the main street, it was about 1.5 miles walking in. Ejido Emiliano Zapata. There were about 200 families there. And when I started going there, the first meeting I had, only ladies came with their children. By the last meeting a year later, all the men were inside. But that took a year of work. And when we were looking at the community and trying to see how we would do this, they mentioned the promotora voluntaria, community health worker. But we couldn't pay them. There was no money. So I went to the community and visited every house and wrote in my little chart the father with his age, mother, her age, and every child with their age. And as I was going through house by house, I identified in each block the most nosy woman, the most gossipy one. I'm serious, I'm not kidding. And I went and I identified one in each block. And then I met with them individually and I said, I need you to be my connector, informant, so that I know what's happening in my community. I don't have any money to give you, but I'll give you a title. You'll be a promotora voluntaria. You will have access to education. So every month, we'll meet. Each of you bring your best dishes to share, and we'll have a course on something. At the end of the year, you're going to have a piece of paper that says you're an official promotora voluntaria. And the most valuable thing, when you come in to see the doctor, you don't have to wait in line. That one got everybody. And very soon what started happening? Doctora, Cynthia's getting married. I think she ate dessert before lunch. So I went to visit Cynthia and put her on. She was in the program for pregnancy. 8 months later, Doctora, the baby's here. I was there. At the beginning when I walked in, all the children hid. It was like Halloween, a monster. Ahí viene la doctora, because I had my little immunization freezer. Okay. After that, after being in the community for a year, it was a totally different story. Doctora, Maria's getting married, but she's doing it right. We put her on birth control. Doctora, I don't know what's wrong with my grandma. She's getting up at night and peeing a lot, and she's losing a lot of weight. She doesn't look good. Before the year was out, the whole community was under control. It doesn't mean they were all healthy, but we knew exactly who everybody was. And I couldn't go. I had my job from 7 to 3. How I knew what was happening in my community was the gossipy ladies in every block. So I want to challenge you today. I'm not naive in thinking that everywhere people will work for free. I know that's not going to happen. There's places where there's already community health workers too who get a salary. And the community doesn't trust them too much because they get a salary. And they say, yeah, you come to me, and the more people you sign up, you get more money. Why should I help you get money? I should get that money. I know there's challenges. What I'm saying is, if you know your community, you find a way to work with them to make this happen. When we were going through an outbreak when I was in another job, and people weren't helping, and the reason people weren't helping was that we started work with the community, and then when the outbreak came, we said to ourselves, we're the experts, we know what to do, you don't know what you're talking about, we'll tell you what to do. So they abandoned us. They weren't coming out to help. And the Minister of Health told me, you need to get the community out. How? She said, I don't know. That's your job. It's your community. If you have to have a dinner, have a dinner. If you have to have a fair, have a fair. If they like to dance, have a dance. Find whatever it is you need to do to get them out. The only way you can do that is in the community. Let's move on a little bit. So these are some examples of what they are called, and we're going to go through this quickly. This model, by the way, works. It doesn't work only in rural places. It works in big cities like New York. That was the example that was there. They are paid. Those community health workers were paid, but the model works. After a year of the community health workers going to people's homes that had risk for asthma, the cases of acute asthma attacks that came to the emergency room dropped by 70% because they went to the homes, talked to them, enrolled them in an education program. They were able to deal with the problem before it got to be so bad that they hit the emergency room. They saved money. WHO Millennium Goals. These are supposed to be for 2 years from now. And as you can see, 1, 3, 4, 5, 6, 7, and 8 are public health related. And number 2 is basic for public health. We know that educated people are healthier people. We are part of a world. We are not here by ourselves. We're supposed to be contributing to this. And the WHO is looking to faith-based organizations, us, to help them achieve these goals because they can't do it from Switzerland. What is our community? Where do we meet in community? In church, right?
So I feel that doing all of these things and working together, forming collaborations and partnerships, I feel that that would be the way that we could perhaps just get a little bit closer to reaching the Millennium Development Goals, which are basically at the core of the public health service.
She's up there somewhere. She's smiling and looking shy. What are some of the challenges? I'm going to move this one ahead. In the developing world, many state health agencies lack these basic capacities in dealing with critical health threats, including their ability to avert epidemics, communicable diseases arising from poor sanitary conditions. Absence of public health funding for health agencies in the developing world for typical agency functions. So in a lot of places, this isn't happening. Remember what we talked about? An outbreak happens. How do you find out? The government doesn't find out in time. They don't have the funds. The point is, though, it's a problem. So if we don't find out, and they don't know, and they don't find out, what is the end result of this? People what? People suffer and die, right? It's not just the numbers go up, people suffer and die. And for years, NGOs have tried to solve the problem. This is Larray. She's married to Boaz. They're in Senegal together. And the problem she notices is the current trends in the dependence on outside funding interfere with sustainability.
So there's a great need to look at community health, which encompasses a numerous sets of things, such as you have, in some cases, you have cultures, and you have people of different religions and so forth. So we need to develop public health interventions that will be able to tackle some of those issues. And by doing that, I think with our philosophy of teaching and the healing ministry of Jesus Christ, we would have been able to deliver health care on numerous levels, whether it's physical, emotional, spiritual level.
We're coming back full circle. What is it that we can do that no one else can do? And if we don't do it, it doesn't get done. And it will save someone's life. There are many offering care, right? We're not the only ones there anymore. Am I right? Okay. What about the rest of it? What about the whole person? What about not just the physical, but the spiritual? Who else does that? Do we really think no one else does that? Are we the only ones doing it? Okay, let's try this. Are we doing it? Are we providing whole person care? When a patient comes to your hospital or clinic, does that person get introduced to who Jesus is? Can that happen in the hospital? Yes, it can. Yes, it should. What about all the ones who never get to the hospital? Who's giving them this? If we're the only ones who can do this, and it's going to save people's lives, shouldn't it be done? So I want to help us wake up a little bit and ask that we move very quickly into those groups. Who here represent academic institutions? Okay, I'm going to ask you, let me see again where you are. Okay, most are here. Please, all the educators come here. And we need to move up quickly. Here, all the educators come here. Who represent mission hospitals and clinics? Okay, that's most of you. Come here to the center, please. The ones that aren't, come here to the center. Who represent the local church or community organizations? Okay. There's a few. I'm going to ask you to meet right here, right in front. And who represent the World Church? Union presidents, health ministries directors. Where are you? Okay, I'm going to ask you to please go back over there where Ted is around the camera. And I've asked 4 public health students who contributed to this to help facilitate the conversation. This is a conversation. 3 minutes. What is our corporate responsibility? When we look at public health's role in mission hospitals and the other way around, as a mission hospital or clinic, what is my responsibility in this? I'm going to ask you to draw close so that we can talk. Yes, Pamela? So academic institutions are here with Olivia. Mission hospitals and clinics are here with Pamela. Christy has the local. There's some more coming from up there with you, Christy. It's a small group. And back there, the World Church with Dayo. We need to get the conversation going quickly because I need to hear back from you in 1 or 2 sentences what your specific responsibility is. We have 2 more minutes. Pamela has a huge group, so if you have a contribution to make, stand up and tell your story so she can hear you. Pamela, there's a hand here. One minute. Pamela, you want to say it so the rest, the whole group is yours. I'll give you an extra minute. Please choose a speaker for your group who can summarize what you thought about in 1 or 2 sentences. It won't be hard for this group, but it'll be hard for this group. Okay. See, when I asked, nobody wanted to talk. Somebody, please have a narrator ready. In 1 or 2 sentences. While we come together, how many of you sang this in Sabbath school? Nobody sang this in Sabbath school? A sermon in shoes? Want to help me with it while the others finish up? Do you know, oh Christian, you're a sermon in shoes? Do you know, oh Christian, you're a sermon in shoes? Jesus calls upon you to spread the gospel news, so walk it and talk it, a sermon in shoes. Do you know the world is watching all that you do? Do you know the world is watching all that you do? Jesus calls upon you to spread the gospel news, so walk it and talk it and teach it and preach it and show it and know it and live it and give it, a sermon in shoes. Okay, we're all together. The World Church, Dayo. World Church is still talking. Do you have someone who can summarize in 1 or 2 sentences? Everybody's pointing to Dr. Handysides. It might be because that's his job. Do you want to do it, or did you see someone, Dr. Handysides, that you think can do it? Okay? Yes. I'm hoping it works. Just a second. Elisa, is it on? See, that's public health in action right there.
It's good exercise.
Yep.
I don't know whether we had enough time to really come to it.
No.
Substantial. But it is our group's opinion that we play a role in facilitating the delivery of health care, public health, and whole person care in the communities, from the World Church, from the union leadership, and so forth. The facilitation is to see that the flow of budgets is to the best of our ability.
Okay.
We must recognize the large gap that there is between our resources as a church and the need of the world. And so it's important for us to perhaps target what we are going to do, which communities we're going to enter. We've talked, I mentioned just a little bit about the drift, the population drift that's taken place in the last 40 years, so that we have a more urban population. And to get the biggest bang for the buck, we probably need to move more of our initiatives to the cities, continuing the ones that we have in the rural areas. We also feel that there's a very important need to incorporate concepts of public health into every aspect of teaching.
Okay.
Whether we are teaching teachers, pastors, nurses, physicians,
doctors.
It's got to be incorporated if we're going to do that.
Okay, thank you very much, Dr. Handysides. Okay, local. Christy, did you choose someone? Okay, the microphone is on its way. It has to be, it can't be her. If not, I won't give her an A.
As the local church, what we discussed in our group is that we need to befriend people. We need to get out and see what is going on in the community and invite them and tell them what is going on with our church. Not just sit here, but be out there.
Outside.
Outside.
Okay, that's why it's a sermon in shoes, because you're walking out. Thank you very much. Mission hospitals and clinics, there's Pamela there. This was the biggest group, the most challenging to hear. Go ahead. Yes.
Good morning, everyone.
Good morning.
Our group, we have so many ideas, but the main thing is to go out and learn what the needs are and use this information to better serve the community. This means building relationships, using the language, and working with the churches.
Okay, thank you very much. Academic institutions, Olivia?
We didn't have much time to discuss, but I think we would like to maximize the resource that we have and the passion of our students to get out to the communities more. You know, because if you get a kid with a goiter, he's excited about talking about iodine in the community. Also, we would like to have more interface between the stakeholders, as in the hospital, in informing the Ministry of Education, because they are developing the curriculums so that the curriculums are more relevant to our communities.
Thank you very much. Thank you. I'm going to skip through a lot of this because we've covered some and we want to end on time. One of the things that hurt me when I read what the contributions were was this statement by Boaz, one of our students, one of my students. And he's in Senegal now, and he's seeing how lifestyle-related diseases are becoming more and more important. And he sees the need for smoking clinics. And he says, sadly, we don't know how to provide one. This is one of my students. Okay? So when we talk about academic institutions, we need to know what's happening to be able to look at our curriculum and teach what you need. Except when they're out, will you give them a job? And how do we get to educate not just those who come to our school, but everybody? Public health is not just a degree that an MPH person has. It's public health. So as an academic institution, we need to find a way to educate the workforce in the principles so that you can do this, for you to be successful. And that means that $40-something thousand degrees is not the answer for everybody, right? I can't afford it. So everyone in your role, I know we didn't have a lot of time to discuss it, I just wanted to trigger something. Think about in your own circle, in your circle of influence, what you can do to make this a reality. There's one thing we all can do in our mission hospitals and clinics, and that's put our shoes and get out and go to the communities. Not wait for the communities to come to us, but us go. You all have seen this statue if you've had a chance to walk around campus. And what I love about this story is that I can imagine the Jewish man on the road, beaten up and left for dead. I know if it had been me, I would have prayed and asked God to help me. And God answered the prayer. Actually, 3 times. Because if this was a road way out there where nobody went because there were thieves and everybody knew, right? How do you explain that within time for one who's beaten half to death, before he died, 3 people walked by? So when he prayed and said, Lord, help me. Somebody, they beat me up, I'm going to die. God said, okay. So he sent a priest who walked on the other side. And then he sent a Levite who stopped and looked and walked away. And then he said, okay, I'll send someone who will actually do something. And he sent the Samaritan. Why this here? Because what we are is God on earth. That's his manifestation today is us. When people ask, where is God when I suffer? We put our shoes on. He knew that people would ask that question. That is why all Matthew 25 is about the absent landlord. See all those different parables? That landlord isn't there, the husband hasn't come. All those different parables about him not being there. Because he knew we would. And that's why he said, heal the sick, raise the dead, you have freely received, freely give. The reason why we're here, the end of it, is relieving the suffering of the people. The decisions we make need to be with that in mind. When Jesus fed the 5,000 plus wives and kids, he knew he wasn't going to get all of them to be baptized into his new religion. Most of them didn't. When he went through whole towns and not one of them remained sick, there wasn't a campaign after he went through, right? The end was the healing, the relieving of suffering. So if suffering is happening in the home and the community, and we stay within our walls and wait for them to come, then that we can do, that no one else can do, is not getting done. I want to challenge you today to go back, put your shoes on, step out of the walls, and reach the people who are suffering where they're suffering. Put on your shoes. Thank you very much. Yes. I want to give just 2 minutes for questions and answers if there's any. Any questions? Either everything was super clear or super not clear.
There's one question up here.
Okay.
Okay, I just wanted to say this is one of the best presentations I have attended, but we don't have the notes in the... Are we going to get the notes?
Yes.
Okay, thank you.
I will send, this isn't a PowerPoint, a normal PowerPoint, so I will send the link to Mo, along with the references of the articles and the clips. So if you leave your email on the list like Jerry was talking about, then it'll be easier for you to be able to receive all the information. Anyone else? Okay, so to honor the request of our friend here, okay, while we go, there's a question, let me find it.
More of a comment than a question. Yes. I agree wholeheartedly with your presentation as a public health student myself. And you made reference to ADRA, and I actually come from ADRA International. Mm-hmm. And so I would encourage everyone here that's in the field to try to reach out to the local ADRA offices as well, because I think this is an opportunity where we can leverage the resources that we both have to reach farther into the community and take some of ADRA's presence and combine it with our church and our clinic and hospital presence and really push the work and the sustainability, as was referenced, and really push it out there to the people.
We have an incredible network, and we need to use it. We can't stay by ourselves. So If you agree with her, she wants, it's not me, she wants you all to stand up with me and sing the song if you agree. Okay, there you go. Let's stand. Dr. Hart, are there announcements? Because I noticed there's a break right after, and everyone goes to the breakout session from here. Okay, thank you very much once again. Okay, 1, 2, 3. Do you know, oh Christian, you're a sermon in shoes? Do you know, oh Christian, you're a sermon in shoes? Jesus calls upon you to spread the gospel news, so walk it and talk it, a sermon in shoes. Do you know the world is watching all that you do? Do you know the world is watching all that you do? Jesus calls upon you to spread the gospel news, so walk it and talk it and teach it and preach it and show it and know it and live it and give it, a sermon in shoes. Thank you very much. Have a blessed day. Muchas gracias, gracias.
I'm at Blood Adventist Hospital in Malawi, and I was just thinking if I don't know.
Yes, go ahead.
Yeah, I was just thinking if you could send some like we have this residency training residents who go to Malawi to just rotate there, and if you